This is Video History, sponsored by the J. Bay Jacobs Library, part of the General Library at the American College of Obstetricians and Gynecologists. Bay Jacobs was a distinguished physician in the years in Washington when one did home delivery, and he practiced by himself. Over the years, became interested in books and libraries as well as other things historic, and so funded the starting, certainly, of this history library at ACOG, which has risen to world-renowned proportions. We're able to interview one of our distinguished fellows each year, and this year it's Dr. Richard Jones from Connecticut. Dr. Jones will tell you something himself about his education. Why don't I let you begin by telling you where you went to medical school and residency and those things so important to us.
Well, I did my undergraduate college time at Yale and then was accepted at the University of Virginia. I had never even been to Virginia, but found myself in Charlottesville, which I loved. And after medical school, of course, in those days you had an internship to do, so I went back to my native Hartford, to the Hartford Hospital, which had one of the great rotating internships of those days, and that's back in, say, 1961. And so a year of rotating internship, and then back to Charlottesville for 4 years of residency.
Who was the chairman then at Charlottesville?
One of the mentors in my life, and fortunately in medicine, it's okay to have a mentor, and Norman Thornton was the chief, a man that I really revered.
As we all did, I think,
a great guy
in his day. Well, beyond that time, you went back then to Connecticut to practice?
Actually, at the end of the residency, I was drafted. It was Vietnam time, and there was some question as to where I'd end up, but instead of Vietnam, I ended up in Heidelberg, Germany for 3 years. Another lucky break, I'll have to say. And I enjoyed those years very much, got to meet a lot of interesting people, but then went back to my native Hartford and went into practice and formed eventually a large practice at the hospital. And just as an aside, the Hartford Hospital program grew, and while I was there, became a very big program, and eventually I ended up as president and chief of staff of the hospital. So that was another part of my career as ACOG was sort of taking off as well.
Of course, the thing was always to ask how many deliveries your hospital did a year. How many did Hartford Hospital do then?
About 6,000.
It
was a big hospital. It's a 1,000-bed hospital, and very proud of the hospital, and has its own freestanding residency program to this day.
Of course, from there you moved on to two really important functions. The first was chairman of your district. What years were that, and any things you especially remember from those days?
Well, how it happened was really curious. I got a phone call from a doctor by the name of Denon, and his father had written the Denon on forceps. And Phil was in practice in Waterbury, Connecticut, a town west of where I lived. And sort of out of the blue, he knew my partners. So anyway, they were in cahoots, I guess. He called me and said, how would I like to be vice chairman of the Connecticut section of ACOG? I really didn't know much about the college at that time, and so I said yes, and I thought years later, it must have been 5,000 meetings later, I finally got to be president of the college. But anyway, that's how it started, and I can't even tell you what year it was, because it was the usual progression from vice chairman of the Connecticut section to chairman of the Connecticut section, vice chairman of the district, and then chairman of the district. So it was, 3-year hitches over and over again over many, many years. It must have started in the mid-70s, I guess, but that's about right.
Were there other states involved in the district?
Yeah, District 1 comprises the New England states. eastern Canada, well, Quebec, and the maritime provinces.
You learned to speak French, I trust.
Well, my French is about as poor as my German.
When was it that you were chairman of the district, or do you remember the precise years?
I don't remember the precise years, but they were shortly becoming sort of on the national scene, but it would be the late 80s.
I know because I checked to see that you were the 43rd president of ACOG, and I know those years. It was 1992 to 1993. What was the pathway that kind of led you up those steps?
Well, certainly it started off at the section and district level, and on one of the District 1 meetings, and we were sort of known in those days as the District 1 Travel Club, and we did travel the world a bit, but I was in Dublin on a meeting at one time, and George Morley was there, a predecessor of mine as president of the college and one of the greats in our field, a wonderful man.
Great person.
And I should digress just for a second to say that after college, I had been an English major in college. I then decided I wanted to go to medical school, but I hadn't done any medical stuff. So I did all my pre-med in 1 year at Trinity College in Hartford, and they asked me if I would teach English because of my major. Mm-hmm. So I taught English, and I told George Morley in Dublin years later that I had been an English teacher. Well, at that time there was some push to make sure that our publications at the college were easily readable and correctly written, so suddenly I found myself on the technical bulletin committee. Well, then fast forward to a subsequent meeting in Paris, and George had gotten to know me through college activities, and he suggested that I might run for president of the college. I was quite astonished, when one of your mentors says, why don't you become president of the college? I was more than flattered.
You were the 43rd president of the college in 1992-93, and I said, can't risk interjecting here that George Morley delivered my second daughter in Ann Arbor, and God rest his soul. What were the issues that you faced at the national level, which are surely different than the district?
Yeah. Well, there were always sort of the day in and day out things that came along, and there were a couple of big ones. But before I get to that, if I can just say that it was important along the way to sort of see how the college worked, and the presidents came and the presidents left, and so forth. And although we had an important function, it was really the ongoing college staff, and not to flatter you too much, Warren, but it was people like you that kept the college really going. And the person that seemed most available to me, you were sort of always available and always answered my calls, but the person I went to rather frequently when I came to the college office was Harold Kamenetsky. And we just sort of bonded in some curious way. And Harold was just wonderful to me, and he used to laugh about, well, where will we have din-din tonight, for example? Well, it's corny to those that haven't known Harold, but at the time it was important, and he always gave me a straight answer about what he thought. And I should mention Harry Vischer, because Harry chaired the technical bulletin function. Doug Knabb was the head of the committee, but Harry was the staff. And again, working on that committee was just wonderful. It opened all sorts of doors for me, and I learned more than I put into it, for sure. And it goes beyond that level in the staff. I think of, Elaine Locke and Shirley Shelton, and it was just a feeling of community, that everybody wanted to help turn out a product that was good for the fellows, and as everybody kept saying, what's the right thing to do for our patients? And I thought, isn't that impressive? That the number one thing was a focus on our patients, and I thought that was quite wonderful. Well, that's to digress. You had asked the important things. Well, one of the important things for me, of course, was that it had become traditional, and I guess it sort of still is, for the president to pick a theme or a topic or an area of particular focus. And I had been at a meeting in Rockport, Massachusetts, at a Massachusetts section level, and a woman named Sarah Buell spoke. And Sarah had been an abused woman who had dropped out of high school and had a baby. It was a long, involved story, which I'll make short by just saying that she ended up first in her class at Harvard Law School and started the battered women's program at Harvard. And that became her life, and she lectured on domestic violence at this meeting. And I had no understanding, frankly, about the topic. I went back to Hartford and talking about an epiphany. Like a week after I'd gotten back from this meeting, I saw a woman in the practice who I had seen for years and had always wondered about this issue. And so I had learned in this meeting to ask about this and how to ask about it. And I said to her, did somebody at home do this to you, referring to bruises and so forth? And she said to me, Dr. Jones, do you know how many years I've waited for you to ask me that question? And I was just stunned. And at any rate, that decided for me anyway that I needed to do that as my focus. I was going to do a breast cancer initiative of some kind because my mom had died at age 50 of breast cancer. But Mort Lebeau, another one of the greats in the college who was in charge of, I don't know what you called it in those days, media relations or some public relations, said to me after a meeting when I had mentioned this to the board, he said, and you were there when I mentioned it to the board, in fact, he said, Richard, you could do breast cancer, but he said, you really ought to do domestic violence because you obviously feel it. And if you feel it and can learn about it, it's easy to talk about it. And that started a whirlwind, which I was just in Basel a couple of months ago, so I'm still lecturing all over the world on domestic violence. So that was certainly a big thing for me. Another big thing for us was NACOG. And NACOG had decided at the time that they needed to separate and become their own organization. At the time, it was quite a crisis, as I recall it, and very upsetting and all sorts of ramifications to it. Looking back on it, I think it was probably the right thing for both organizations. But when you were in the midst of it all, it was difficult, and there were financial things and all sorts of other things that we were worried about. But as I say, I think it ended up where it should have ended up. I don't know how you feel about it, but it was a difficult time. Another thing that came up that year was your retirement. Now that was sort of a bad and good story. I was sorry that you were retiring. I didn't know what was coming. I was on the search committee that picked the right person for your successor.
You did indeed.
And Ralph's been terrific. But it was difficult to sort of preside over your departure. On the other hand, we had lots of fun presiding over it. And the festivities were fun, and the naming of the building and the time capsule at the building. And buying you a railroad train and stuff like that.
Which is still running.
Yeah, I mean that was fun, and to not mention the enjoyment of meeting just an extraordinary group of people at the college, and then all over the world as I was invited to various places, and during that time was asked to be a fellow of the Royal College of OB of Ireland. Another long story which we don't have time for, but it was a pretty exciting time.
Did you react as things came up during your presidential tenure, have any of the other districts that were particularly important or concerning, or?
I don't recall crises in any other districts, but as you know, the evolution of the districts from a national point of view is that every year several of them rotate out, they turn over, whatever. And the districts that I was sort of simultaneously going through the system with were 4 and 7. And so I got to know the chairman of District 4 and chairman of District 7, and that's of course remains to this day. And even now, as I come to these annual clinical meetings, it seems to be those people that I see the most of, because we had our trials and tribulations simultaneously, as it were. Of course, when you're president of the college, not only do you have a bit of a soapbox to stand on and preach about things, you're asked to go all over the world and do all sorts of fun things. Pete Hollis and I just had lunch together, and we were talking about our invitation to Mexico City and the wonderful welcome that our Mexican colleagues have given us. So, you know, we did a lot of traveling and a lot of speaking and representing the college to our fellows all over the country. It was great.
The college, as recently as seemed to progressively expand past Mexico into Central America and moving into South America. Were you at all involved, or was that an issue?
It was not, although I was the first president, sitting president, to ever officially go to Mexico. I went to Mexico City, and I can tell you, since you and I love to tell jokes with one another, that I made the mistake in Mexico City of starting my lecture with a joke. Now, I can just tell you, Warren, be very careful. Don't ever tell a joke in English when it's translated into Spanish or French or whatever. I thought it was really a wonderful joke. I've forgotten what it was, but at the end of the joke, I had to wait for the translation, and there wasn't even a smile in the audience. So it didn't translate well. But the Mexican hosts, some of whom are here today, here in Washington, were very, very gracious, lovely people.
Did you have, harking back to those days, did you have issues that seemed to be geographic, that is, that applied primarily to New England and not to other places in the country, and how could you handle that?
I don't remember things that were unique particularly to New England, except that I remember how often at district meetings that when we asked our Canadian colleagues to comment, that they were always perhaps a year or two ahead of us in terms of the social evolution of our specialty. And so from that point of view, I thought that the Canadians were somewhat different, but enormously prescient in their predictions of what will happen. And I suppose that must have been true for other districts who also had a Canadian counterpart.
Well, perhaps yes. I think that my father being many of my family good Canadians, Western Canadians. I think that the French and the aspects of things in the New England eastern part were different than the farming country in the West sometimes, but they've certainly been great allies.
Indeed they have. I believe it was, by the way, when I was president of the college that you and I were in Ireland together for a meeting when we went to the president's home for a reception, and you talked about your ancestors in Ireland, if I recall.
Yes, my
your grandfather or something.
Well, my great uncle and his brother, who I guess must have been my great uncle as well, but we only knew one, who were the two of the first people killed after the Easter Sunday Rebellion in Ireland in 1916. So,
And if I recall, you discussed that with Mary Robinson at her.
probably.
Yeah, I think you did.
Well, the Irish by that time were all on our side, so it's all
That's
right.
where they should have been.
Did the when you were completed is not the right word.
Through.
When you had completed your good work as president, how did you involve yourself with the college beyond that? How did you feel you could have the most input to things?
Well, I'm not quite certain how to answer that, Warren. I have the feeling that, well, put it this way. I think that once you're through being president and then a year as past president, that although perhaps some of your insights into things are of some value, I think it's about time to basically step aside. So although I continued the domestic violence initiative all these many years, it's 13 years later, I'm still lecturing on it. In terms of the activities of the college in a more general sense, I didn't feel that it was my role particularly to be involved. So I didn't really stay very involved. I did some, well, I've forgotten even what committees I was asked to work on, and certainly the nominating process and all that one stays involved with. But I always had the worry as I watched people go past when they should have retired on my hospital staff, that maybe you want to go out at the top of your game, stick around for a while for advising people, but remain involved on a daily level like you had been, I thought was a mistake. So I'm not sure I answered your question exactly the way you had it designed, but that's the way I sort of viewed it.
I think, as you said that some of our political figures might be well served by your advice.
Yeah, well, I think so.
Are there any things that you see now as special issues that are facing the college as a large group that are going to need attention?
Well, I guess I should have mentioned in conjunction with the answer to that question that I was president of the college at about the time the whole subspecialization issue arose. And although I could see that subspecialization might well be in the interest of the patient, the best interest of the patient, which we kept referring to, I wondered as a membership organization if it was in the best interest of the fellows. Because I could see a real dilution of what the generalist was going to do. And that certainly came to pass. Now we're even talking about hospitalists, so yes, that suddenly one more little piece of what the generalist that you and I learned to be is going to be gone. And I thought, what's going to be left for the generalist? And I thought, well, I had nurse practitioners in my office who did pelvic pain and vaginitis and sexual counseling and lots of stuff, terribly important, but stuff that did I, as a specialist OBGYN, what I thought was a specialist, but I guess a generalist OBGYN needed to know how to do. And I wondered what was left. Now, just this morning on the general program, the president's program, was a discussion about where this specialty needs to go. And I thought it was absolutely on target, and that we need to be into research, we need to be into the science of reproductive health care, and there's a wonderful niche for us there. But I must admit I've had some worries as to what is the real function of what you and I at least grew up to think of as an obstetrician.
If we're all concerned with the ethereal, yeah, who will take care of the sick?
Well, that's the worry. Yeah. And I think one of the things that has sustained me in medicine is frankly the fact that I was an English major. And I have thought so many times that if doctors were better based in the humanities than less based in physics. That might be a good thing for patients. I think some of the curriculum in the pre-medical years was perhaps in the wrong place. I think that a liberal arts education